Good day, everyone. I'm Mary Grace Mosqueda, a practical nursing student from St. Augustine School of Nursing in Iloilo City. Today, I am going to perform a bed bath demonstrating. A bed bath means to wash someone in bed, and it's important because it cleans the skin and helps the skin be free from infection. Prior to the conduct of the procedure, I perform hand washing and sanitizing with alcohol to protect my patient and myself as well from infection and cross-contamination.
Then, I have to close the door, fix the curtains, adjusted the room temperature, and provide adequate lighting to ensure my patient privacy. Before we start, make sure that you have your wash basin with a warm water, a liquid soap, a washcloth, a back blanket, bath towels, a moisturizing lotion, deodorant, working gloves, and a hair comb. Behaving this equipment needed on hand and organized, it ensures our efficiency as a nurses.
So what I'm gonna do now is to introduce myself to my patient, verify my patient identity using the two identifiers, which is done to make sure that I am doing the right procedure for the right patient. And of course, I have to explain to the patient the procedure that I'm about to do. Good morning, ma'am. I am Mary Grace Mosqueda, your student nurse for today. May I see you? Miss Brown, please. Thank you, ma'am.
And today, I'll be doing a bed bath, which means that I'm going to wash your body and remove the accumulated dirt and all perspiration in your skin. And of course, for you to feel refreshed, will that feel right? So I'll begin now. Would you like to void at this time? Now, I am going to don my gloves. In the hospital setting, naturally I have to raise the bed in the comfortable working height and lower down the side rails at my side. After doing that, I have to assist my patient to move closer to my side of the bed. After that, I'm gonna do drape bath blanket over my patient. Now, remove the top sheet that is beneath the blanket. Ma'am, I'm gonna remove your patient gown. So, if the patient has intravenous line injuries or reduced mobility at one side, then I should store it at the unaffected side. Ma'am, please side out, hand. After removing the patient gown, now I have here a wash basin with warm water. It is about 2/3 full, which is at 43 to 46 degrees Celsius, but I'm gonna have to let the patient check the temperature if it is tolerate for her. The next thing I'm going to do is to remove the pillow under my patient head. And then place a back towel under the patient head over his chest. So I'm gonna start by washing your eye first, ma'am. So I'm washing the patient eye first. Thing to do is to soak the washcloth in the water, wring it thoroughly and fold it to create a bath mitten. So in bathing the patient eye, you should start the inner canthus and the outer canthus using a separate section of the cloth for each eye. After washing and drying the patient eye, I'm going now to proceed to washing the patient forehead, cheeks, nose, ears, and neck. So ma'am, would you like the soap to be used on your face? Starting from the forehead, and then cheeks, nose, ears, and neck. After drying the face with the use of towel, I'm going to proceed to the arm. So I'm gonna have to place a towel underneath her arm and then start to wash her arm in a destinal to proximal manner, means from the hand to the axilla. Okay, so using long perm stroke, I'm gonna start to wash my patient. Okay, then into the hand. After washing, dry it. And then have patient raise her arm over her head and lightly support it. Now I can start cleaning the patient axilla and dry it. Use the deodorant if needed. Now that I am done with my patient left arm, I'm now going to proceed to the exact same step with the same right arm. I'm now going to proceed to do the exact same step with his right arm. So now I'm going to proceed to batting my patient chest. I'm gonna have to do is to drop over a bath towel over his chest or cross his chest while I lower down the back blanket just above his umbilicals. Using a bath net, start cleaning the patient's chest. Of course, pay attention to the skin beneath the patient breast because these areas are very prone to sweating or perspiration, and as we all know, bacteria will drive us in these moist areas. Dry the patient chest. Okay, now I'm going to proceed at her abdomen and I'm going to drape another bath towel over her abdomen, lowering the back blanket towards to his pubic region. So I'm gonna start washing my patient abdomen. So in washing my patient abdomen, I'm going to keep it covered with a back-up blanket and pay attention to the surrounding skin. dry the abdomen gently, and so now I'm done with my patient chest and abdomen. I'm now going to move to my patient legs. I'm going to start washing my patient legs. First thing to do is expose her by holding the back blanket to the midline, keeping the perineum covered, and then place a back towel beneath his legs. Okay, now I'm going to start washing my patient leg. Using long firm stroke, wash the patient leg starting from ankle to the knee, and from the knee to the legs. Assist for any skin redness, swelling, bruising, or pain. So now start cleaning for the patient feet to the toes, toenails. Pay special attention to the skin between the toes and the toenails. Now soaking the patient feet in the warm water for 10 minutes would help maintain cleanliness of the feet, toes, and toenails. But it is important to remember that we should not soak the feet of the patient with diabetes or patient with impaired sensation, because this might actually cause harm or injury. Now that I'm done with my patient left leg, I'm going now to proceed to my patient right leg and do the exact same step. So now that I'm done with my patient interior side of the body, I'm now going to discard the water, the washcloth, the gloves that I have used, and replace it with the new fresh one. Since now I have done the set of glove and I have refilled my wash basin with a warm water, I'm now going to assist my patient to a prone side lying position so that I can clean her back. Okay ma'am, I need you to lie facing your right side, and I'm going to place bath towel at the side of her back. So now I'm going to start cleaning my patient back and buttocks and paying special attention to my patient's skin. If the patient's skin intact, then ask the patient if she like to be given a back massage. Then apply a moisturizing lotion on the patient back. Okay, so now I'm done bathing my patient. Ma'am, can you roll back now? Ma'am, I have here a new clean dress and I'm going to help you to wear it. Now help the patient with combing her hair. Okay ma'am, now that we're done with your bath, how are you feeling?
After doing the procedure, I'm going to proceed to doing the aftercare of the equipment that I have used to maintain cleanliness and orderliness. After that, I am going to proceed to the hand hygiene. So again, I am Mary Grace Mascada, a practical nursing student from St. Augustine School of Nursing, Iloilo City. Thank you and goodbye.